Okay, so if you don't mind, I'd like to go over the plan with you, go over some things about what we're going to do about today's visit.
Sure.
So we're going to get you some lab work done today. It's an annual, you get the annual labs. We're also going to be checking a few things. Since you have had a prior history of insulin resistance, we're going to go ahead and get a fasting insulin level on you. We're going to check your lipids, see how your cholesterol is doing, and all of that. Some of the things I really want to talk to you about was the smoking. So you said that you smoke a half pack a day.
Yes.
And you said you weren't really ready to quit. Is that true?
Not yet, no.
So, and that's fine. I can't force you to do that, but I can educate you about some of the risk factors that is going to, you put yourself at risk for when you choose to smoke. So,
Okay.
Both of your parents have hypertension, so that already puts you at risk for having an increase in blood pressure. But when you smoke, all that extra nicotine makes you more likely to have an increased blood pressure as well, which puts you more at risk for a heart attack and stroke, which you also have a family history of. So you are already genetically predisposed for these things. So just so you're aware, it's your choice. But if you ever do decide to quit, there are resources that you can use. You can go on the CDC's website, the Center for Disease Control. They can give you a lot of different resources about different life coaches, different plans for quitting, referrals. You can also dial 1-800-QUIT-NOW, and you talk to a real life person. They can kind of walk you through the process if you ever decide that's something you want to do. And they have different things like nicotine patches or gum to help you with the cravings and that sort of thing. The other thing with the smoking is that it does put you at increased risk for blood clots if you're on birth control. And since you're not on birth control, that's kind of the next thing I want to talk to you about. They have many forms of birth control. Most of them are hormonal. So you've got like what you had before, the Nexplanon, you take, or the pill. You've heard taking the pill. They all have hormones. When you combine the pill or any of the ones that have hormonal methods with smoking, you're more likely to get a blood clot. And we don't want that to happen. So I was going to recommend to you to get an IUD, specifically the copper IUD that goes inside your uterus. And the copper IUD has no hormones, so it doesn't put you at any increased risk for developing blood clots. And also they last for 10 years, whereas some of the other ones that with our hormonal methods, they don't last as long. So that way you won't have to think about it. You just leave it in there and it just does its thing. Do you have any questions about that?
Yeah, I have a lot of questions, but no, keep going.
Okay, so that's the IUD will help prevent you from getting pregnant, but you'll still need to use condoms.
What for?
So the IUD prevents you from getting pregnant, right? But the condoms will prevent you from getting STDs. So a lot of people think that if they're on birth control, they don't have to use condoms anymore because they're already protected. But the condoms prevent the STDs, whereas the IUD will not do that. So does that make sense why you need to use condoms while you are currently still sexually active?
Yes.
Okay.
Because I'm still sexually active with guys.
Yes. And, pregnancy is one thing we want to avoid, but we also want to avoid getting any STDs like, gonorrhea, syphilis, all of those things. You aren't protected just by having an IUD. Condoms will be protecting against that. The next thing I want to talk to you about is I'm going to be giving you some antibiotics because it does seem like you have a case of the pneumonia again. You said that you get it pretty much every year.
Yeah.
Yeah, and your lungs sounded pretty bad. Yeah, I can hear the wheezing even without my stethoscope. So we're going to go ahead and put you on some antibiotics just to kind of clear that up. But one thing I want to make sure that you know is that you need to complete the whole antibiotic.
Can I just quit when I feel better?
Yeah, I know. See, people think that they can just take a couple days and they start feeling better, and then they stop taking it altogether, and then it doesn't quite fight off the infection, and then it comes back stronger, and then the antibiotics won't work anymore because you've developed resistance.
Oh, I understand. Thank you for clarifying that, Nurse Grace. You saved me from making a stronger pathogen.
Yes, that's what we want to avoid. So you can promise me that you'll take the whole antibiotics. That make me very happy.
I promise.
Okay.
I want to make you happy.
So the other thing we talked about is you didn't get the flu shot.
Not like that, though. I have a boyfriend.
Okay. The other thing I want to talk to you about is you didn't get the flu shot this season. And I was going to recommend that you go ahead and get that. Since you are already at risk, you're already immunocompromised with being a smoker and already having pneumonia. And even young people can get the flu really bad, and it's an easy vaccine.
Mm-hmm.
But in combination with that, I was also going to recommend that you also get the pneumonia vaccine.
Pneumonia vaccine, but wait, isn't that for old people?
Typically, people over age 65 are recommended to get it because their immune systems aren't as strong.
Now I'm 23.
Right. Young people typically have a stronger immune system, but
I have 42 years to go before I need the vaccine.
that was very good mental math. So since you are a smoker, the CDC recommends...
Depending on what my birthday is not September 16th, yeah.
That's your birthday.
Yeah.
Your birthday.
No, that is my birthday.
Your birthday... Oh yeah, it is
Ha.
September 16th.
Ha.
I was just testing you.
I know my own birthday.
That was a good memory. The pneumonia vaccine is also recommended for anybody over the age of 18 if they're currently a smoker.
Hey, that's me.
Yes, that would be
I
you.
meet both of those.
Yeah, so you could actually qualify to get the pneumonia vaccine anyways. Since you do have a history of getting it every year, I would highly recommend it because it doesn't take much for you to end up being hospitalized. That's a really big...
So you're saying I can get it now and I don't have to wait 42 years?
No, you can get the pneumonia vaccine now, you can get the flu vaccine now, and you'll be good to go.
Cool.
The
I
other
hate waiting.
Yeah. The other thing is that after you're finished the antibiotics, we're going to go ahead and schedule a chest x-ray just to make sure that it's been cleared up, just make sure that the infection is gone, just make sure that there's nothing left if we need to keep continuing on antibiotics or if it's been cleared up. So we're going to take a few weeks after you finish that course. And the last thing I want to talk about is that you mentioned earlier in the beginning of our exam that you don't perform self-breast exams if you don't know how. So I was going to go ahead and teach you how to do that.
That whole breast stuff is new to me.
Right. So with self-breast exams, it's really important.
Even though I have 2 of my own.
It's really important to be aware of your own body and what's normal for you, so that because you're the one that's with you all the time. You might come in to see me once a year, or maybe more if you forget to come in for your annual. And so I might not be able to catch it as soon as you would. So you're more familiar with your own body. And so the best time to do it is once a month at the same time every month, because your hormones with your period can cause fluctuations in your breast tissue. So like one time during the month it might feel different than another time of the month. So you want to compare how they feel the same time every month.
Because I have periods because I'm a woman, right?
Yes.
Okay.
So I often tell my patients to go ahead and just do it in the shower since they're already, it's already available and it's wet, and so it's easy to like feel for it. So there's different methods you can do. So what you want to make sure you do is cover the whole breast tissue.
All right.
So we move your hair there. So there's different. Where'd it go? Oh, there it is. So you want to move all the way around the breast tissue. So you want to get up to the collarbone, because actually you have breast tissue all the way up to your collarbone and up into your armpit here. A lot of times breast cancer or nodes are swollen or like in this area under the armpit. And there's different methods you can do. You can do the up-down method like this, covering all the breast tissue, or you can start at the nipple and go around in a clockwise circular motion. So do you want to practice?
On myself?
Yes.
Okay, good. Good, yeah. Sure. Clockwise.
Yeah. Start and just move all the way around. Make sure you're feeling everything.
Okay.
Or you can try the up and down method where you just feel all the way up and down.
Can I do clockwise and up and down at the same, like if I do one?
It's probably better if you just stick to one.
Okay.
If you don't like any of those, you can try the, here, let me put this way. You can try the method where you go in and out like this.
Okay.
And just cover the whole breast tissue. Here, if you just want to.
Oh.
And so what you're going to look for is any dimpling. So see how those are dimpled right there?
Yeah, that definitely looks like cancer.
Yeah, you don't want that.
Okay.
If there's any skin changes or texture changes.
My whole breast looks like a tumor.
Yeah, maybe you should.
I think you just. Yeah, no, I think we're good. You just got rid of it.
Maybe you should get a mammogram.
Okay.
Anyway, so that way you can be aware of what your breasts feel like. And, bring it to our attention, and the sooner we catch it, the sooner we can, the more likely we can treat it without having any serious repercussions.
Okay.
The last
I'll come here more often.
Good.
For health reasons.
The last thing I'm going to give you is your prescriptions. You can take it to your pharmacy and get them filled. We're going to get you a Rocephin shot today in the office. That will just kind of give you a quick boost of some antibiotics to go on top of the ones you're going to take by mouth. When you get to the pharmacist will tell you how to do that. You're also going to be given some albuterol. This is an inhaler to help open up your lungs. I know you've been feeling kind of short of breath, so this will make it easier for you to breathe. You can go ahead and use that.
That'll be nice.
2 puffs every time you use it. And the last thing we're going to give you is
Puffs is a trigger word for me, so
what is
puffs? Because I
okay.
smoke a lot, so.
Well, maybe you can puff on this instead of the cigarette.
My inhaler?
Yeah.
Can I go through 2 packs of inhalers a day? Wait, half a pack.
No.
Okay.
The last thing is we're going to start you on some steroids. So that
It's not really a replacement.
Huh?
Just so you know, like that won't help me quit.
We're gonna start you on some steroids. It's a Medrol dose pack. So you'll start. The pharmacist will give you instructions. It's gonna taper you off slowly, so you don't stop completely. And this will help with some of the swelling, inflammation around your lungs. Just kind of cover all our bases here. So these are your prescriptions. You can go ahead and take those with you to the pharmacist. Is there anything else you would like to talk to me about? Do you have any questions about anything?
I think we're good.
Okay, well, it was great meeting you
Nice to
and
meet you
taking
too.
care of you. Hope to see you later. And follow
Thank you,
up.
Nurse Grace. You're my favorite nurse ever.
And
you should get a raise and a great grade on this PowerPoint. If you were to use that for such means.
Okay. I will see you later. We'll follow up in a couple weeks.
Thanks.